Hello, my name is Dr. Malini Uppal. I'm the Medical Director, Lead Clinician at Kenneth City Fertility. I decided to become a doctor. It's not a very easy question to answer, I must say. However, I decided to become a doctor because I think what it is, it's who you are. And I think I am a curious person. I'm a person who wants to be as close to humanity as possible, be involved in all the good and the bad of the humanity, and it because medicine has got that problem solving kind of nature of it, which is what I like to do. I think being a doctor is the best and the highest pursuit of one's life's work that you can do, and be involved and compassionate and as close to the humanity as possible. Fertility, actually, I never thought initially that I would do fertility till I was doing medicine and I was doing my postings, and I had a colleague who was older than me, more experienced, and very passionately doing medicine. However, there came a time in her life that she had to start thinking, well, I have to, because of the ticking clock in our women's body, as we all know, she had to kind of take a break in her career and actually go and pursue starting a family, because otherwise it would have been too late for her. And that kind of started me thinking that, for women who are ambitious, I think I have a very big drive for things like social egg freezing and social fertility freezing, is because every woman deserves a chance, opportunity to live their careers, live their ambitions, do what they want in life, and that's where fertility came into picture for me. Apart from, yes, it's a wonderful feeling when you help someone conceiving and starting their family, but I think fertility preservation is something very close to my heart, because I am in a profession that takes a long time to finish, takes a long time to establish yourself, and then you don't want to not have a family, or you should not have to choose between one or the other. So I'm born and brought up in India, in New Delhi. I did my medicine and my post-graduation for obstetrics gynecology also in India. And then I moved here in 2000 to UK in 2005, and since then I've been here. I've done another master's in post-graduation at University College London, and since then been trained into fertility, and now working at City Fertility, Kenneth City Fertility, from last 6 years. The most rewarding about my job is that smile, and is that family that comes back to see us. So in fertility, as you know, that we will see couples who are stressed and have been trying, and it's a very, very emotional journey that we go through with them. And then and it's not always straightforward. It's not always that we get a result in the first cycle or the first transfer or the first treatment. And then being in the journey with them, and then when in fact there is a big long gap in between, because they go away for 9 months, and then when they come back with the little baby, with that little miracle that they have, and the smiles that they have, and the satisfaction that they have on their faces, that that brings the joy of a family that they have, is the most rewarding thing that we get. What my patients value about me, you should be asking this to our patients. But what I think is that little bit of personal touch, the little bit of personalization of the treatment. We don't treat, or I don't treat my patient as just a number. They are a couple, they're individual, and I treat them very well as individual case, as individual, their history, their where they are in their lives, their emotional standings at that point. Everything is taken into account very respectably. This is what I do. And I think my approachability, that my patients are reassured that they can approach me at any point of their treatment. If they have any questions, I'm always there. I'm happy to answer. And as I said, we see them usually after a long break, after 9 months, once they're successful. And when they come back and they tell us that, they have appreciated that by myself or my team, I would say. I have a wonderful team. And emotionally being there for them throughout their journey, good or bad, successful or unsuccessful, but we are always there with them. Regarding my patients, what I like about them, I love all of them. What I like is the trust that they give me when I have to do their treatment, and they believe, and I think that's such an important, crucial part of any sort of treatment, especially when it is such a sensitive thing, like having a child or creating a family. And the trust that they give it to me and believe in me, that I can take them, I can do that for them, or I can help them creating their dream family, is the most wonderful thing.